Well, Tampa General Hospital is creating an outreach program to help more Black patients get kidney transplants. Doctors found that racial bias in a widely used test kept thousands of Black people off the transplant list for decades. 10 Tampa Bay's Angelicia Bruton spoke to the surgical director about the test and what's being done to repair the damage.
Tampa General Hospital says transplant centers in the U.S. switched to a race-neutral test this year, and now they're adding more resources to erase the damage that was done.
It was felt that people of color had more muscle mass, which would artificially elevate the blood creatinine levels.
Doctors found the old test used to check kidney functions overestimated how well Black patients' kidneys were functioning, making them appear healthier than they were.
This was decreasing access to transplant because in order for a patient to get referred to a transplant center, their kidney function has to be at a level of 20 or below.
Now, with the new test in place, TGH is starting a transplant access program that will include a social worker and transportation for patients.
We have providers within our center that will be the forward-facing interface for these patients to help increase their trust within the medical community.
Something Crystal Pitts with the LifeLink Foundation believes is needed.
There's some room for education, education on on chronic kidney disease, education on dialysis and the long-term effects, and just in general about being an advocate for yourself as an African American.
LifeLink says 60% of the people on the waiting list are either Black or Hispanic, and patient Patricia Walker says many aren't even applying.
I met people who've been on dialysis for 15 and 20 years, and it become a lifestyle for them that they think they have to accept.
She says TGH visited her church.
May the 23rd, I just got on the waiting list.
And it helped erase a lot of fears.
They are striving to present to this world an option to life.
Angelicia Bruton.
I keep a bag packed and ready to go.
10 Tampa Bay.
And the hospital says it's using money from a grant to help fund this program. Right now, it's still in the planning phase. They hope to have things up and running by September.